Tuberculosis, or TB, is an infectious chronic cough that attacks the lungs and gives sufferers fevers, chest pains, and makes them cough up blood. It's transmitted in the air, person to person, often through sneezing, singing, and speech. And according to the World Health Organization, it is the second most deadly infectious disease in the world. Jose Velasco is the executive director of the US-Mexico Health Commission. He says TB is largely preventable and treatable in the US, but an international border can complicate that.
The diseases, they don't respect borders. They just cross the border without any respecting any color or flags or countries.
Illegal immigration is often blamed for cases in the US, but Velasco says it's far more complicated. He says the transmission of disease is happening in both directions, from both sides of the border, particularly in cities with border economies, like El Paso.
There is a dynamic border, changing, coming back. Some people live here, they work in Juarez. Some people live in Juarez, they come here and work here. So there is a lot of changes. It's not like a unique community. This is very diverse community.
In the US, when somebody contracts tuberculosis and becomes an immediate health threat, they are quarantined and isolated from interactions with the general public. But in Mexico, health protocols differ.
When somebody here has tuberculosis, he has to receive the treatment, otherwise we can detain him. In Mexico, they don't. So we had to negotiate with the government in Mexico to monitor that person without breaking the human rights.
The main approach has been brokering cross-border binational partnerships and initiatives to allow for the sharing of information and best practices to tackle public health threats in both countries.
Our job as a federal agency, we provide those cases to Mexico. Same thing. Let us develop a vaccine initiative for the border. For nationally. Hold on, the border is different. We need to develop and tailor that initiative that is appropriate for these specific communities.
In May 2014, US Senator Tom Udall announced legislation to provide grants and funding for cross-border collaborations and public infrastructure for detecting and monitoring the spread of infectious disease. As a Center for Disease Control medical officer in El Paso, Miguel Escobedo is a collaborator in existing programs such a bill would complement and reinforce. He says the Center for Disease Control quarantine stations are strategically located in San Diego and El Paso to manage infectious diseases before they can be spread to other parts of the country through trade routes and migration.
People who may be coughing and have tuberculosis and could potentially spread the disease to others. And a very important tool is that we were able to work with partners to detect, to find those individuals and getting them to treatment.
The Center for Disease Control quarantine station is also focused on monitoring West Nile and dengue fever. Escobedo says unmanaged, US ties with Mexico, or any country with higher incidences of contagious infections, is a problem. He says diseases like TB can develop resistance to existing forms of medicine and treatment, risking a more widespread problem in the US.
Because you have drug-resistant germs, and by bringing them and sharing them across the border, we are better able to identify and track the development of resistant bacteria so that we can develop appropriate antibiotic and treatment strategies to deal with this drug-resistant TB bacteria.
But doing that effectively means monitoring and testing in areas outside the US. Escobedo says that's where collaboration between the Mexican government and organizations like the US-Mexico Border Health Commission becomes essential. Executive Director Jose Velasco works on specific policies to make it happen.
It's very difficult to cross the border, so we need to negotiate to change to allow the immigration to cross those samples, to send it to CDC or NIH to test it.
Still, CDC medical assistant Miguel Escobedo says prevention is the main line of attack. He says work is being done on both sides of the border to provide education and awareness of infectious diseases and how they can be contracted. According to the World Health Organization, 95% of tuberculosis-related deaths occur in low and middle-income countries. For KRWG, I'm Simon Thompson.